benvolguts assistents, autoritats, membres del govern, representants de l'hospital. M'agradaria ja, canviar en anglès, a presentar el que ha sigut l'aventura d'aquest congrés, el Simposium i el curs que estem engegant actualment. I am changing to English now. This is just to present this initiative for TB, which has 3 legs. The symposium that wants to be in an annual basis, trying to answer to a specific question. The course, the clinical course, that will be an e-course, virtual course through the internet, and the TB Watch website that will be a new tool for the TB community. So the Open University of Catalonia is very well specialized in this e-learning, so it has a long experience mainly in humanities, history, languages and so on, but now it's introducing in the field of the health education. And we were challenged 1 year ago to set a TB program in this university. So we are in the experimental unit in Badalona, and we have been working on that for a long time, and we have we try to be as much pedagogic as we can, trying to explain to ourselves how is TB, the natural history and so on. So it was a kind of challenge for us, and we accept this challenge, and we are in this position to present this course. Also, the Orme Institute is with us in this project. The Orme Institute is a very well-known institution in South Africa, working for the eradication of TB and HIV. You know that South Africa especially is a special place where you have the highest incidence in percentage and absolute numbers of in HIV and TB, and both co-infections and diseases, so it's a massive problem there. So instead of hiding the problem, what South Africa has done is work actively against TB, and they have invested a lot of efforts from their own government, but also attracting funding, attracting enterprises, attracting public money from all the world, trying to fix this problem. So they were very enthusiastic on this kind, to collaborate in this kind of e-course, e-learning. So they are with us on that. And this is the course. This is the clinical TB management. As you will see, this is a kind of 4 months course with like 15 numbers of credits. The language will be English, so this is open to all the world. So this is a kind of I don't know if you are familiar with the e-learning. I am not actually, but I mean the thing is try to every week a topic will be set, and then people will be challenged to learn a specific objective, and we will provide these people with specific topics. Very like capsules, like videos of 5 to 10 minutes, in order to, if you are in the metro, you just look at this video about, for instance, the formation of granuloma, something like that. Instead of reading a novel, then you look at the granuloma this time between 2 or 3 metro stations, or something like that. So this is the idea. This is set for people that is already working, so for professionals of the health system, not only MDs, preferably MDs, but we know that, for instance, in Africa there are not too much MDs. There are more, for instance, nurses that work for TB. So this is very important. We will accept any kind of curriculum vitae, and we will analyze that if they can participate in this course. So then you see here the different scenarios, the different credits. First, we will talk about the natural history. In this regard, we will show these different progressions on what we think it's most new in this field, And also we are including something is very interesting, we think, is the systems biology. And for instance, in this regard, we can offer, let me just show you what we have set in this case, for instance. So this is like for systems biology, this is the program that the pupils in this year will work. For instance, this is a net logo basis, this is an open basis in which you can set your in your system the population, the infection prevalence, the active TB prevalence, for instance, diagnostic delay, AIDS rate, abandon rate, diagnostic rate, and once you have set that, you can work with this, and then you have this all these statistics of the healthy, infected, sick, treated, on treatment or in risk of relapse, and then you just follow this progression through the time, just to analyze the different the impact of the different factors in the induction of the disease. So you can do that. We think this is very important so far. The problem of science so far is that you have a lot of information, but in proteomics, metabolomics, genomics, and epidemiology, but you don't have tools to manage this information. So systems biology is a very nice tool to work with that, and we will intensively work with this through all these different courses. We will change this this program in different levels, from the epidemiology level to the tissue level to the molecular level, or whatever we could need. So this is just one example of that. If then we will go for the case-based clinical management. So every week we will give a specific clinical case that will be discussed virtually, and then we will focus in a specific topic every week. So for instance, the first week will be set on pediatrics, and then for instance we will go in deep on the radiology for instance, radiology in the pediatric diagnostic or adult pulmonary TB case, and then we can look for the diagnostic for the egress, for NDR, for HIV management. So this is the basis of how we are going to address this learning. Finally, we think that epidemiology, of course, is very important, and advocacy. We will try to focus very much on advocacy. Well, of course, on the control of the disease, but also on advocacy, because we think that TB is a hidden disease. We need a lot of visibility, so we are going to try to set as much tools as possible in the advocacy in order to make visible this disease. Usually when you talk to a politician, it's not the case, but you say, well, I am working on TB, and they always say, but TB was not eradicated. This is usually what you listen. So I think this is not a problem of the politicians, it's a problem of all the population, and we think we must be especially active as the TB experts to try to make this visible. So we are going to address this issue very actively. We have this platform that will be presented in maybe next month about a new website in order to the patients to show their experience. We have now a program set by the WHO, this and coordinated by Planeta Salut, that will teach patients to be active in the internet, trying to make their their own pictures, their own videos to make visible the disease. This is very important. And finally, of course, the contribution of the Orme Institute, very much experts on the field, and the control of TB in a high incidence country. This is the first edition. I mean, it's not the best one probably, but it's the first. So we have a lot of illusion on that. We are thinking on including a practicum. Indeed, the Orme Institute asked. Well, they wanted to offer a kind of practicum in South Africa. We have other options even in Europe to do that. So this will be set through time. This is just the first years of that. So here you can apply to that because we are going to start next month, 16th of October. So you just look to the website. You will see how to apply. You look here, fill the form to access. You must send your CV in order to be analyzed by our team, and then decide if you can apply or not. And even there are some grants that come from the 50% of the fee or less, depending on the origin of the applicant. So this is the second leg of this project. The third leg is the TV Watch website. This is another website on TV, but we want to have this website very much focused on the professional and very simple, as much simple as possible. So you see here that we'll have these chapters. We will, of course, you can register, and then we will have a kind of who is who in TV. It will be set in this constantly updated in this map. But the most important thing is that we will have this. So this is how it looks like. How to register on that, and the most important thing is that you can address questions there. You can answer these questions as a professional. You give your opinion, and what is more important is that this will be scored. I mean, people will have they will be able to vote both the questions and the answers. So it will be kind of a scoring for all this activity. So to make this more intense, more emotional. The other thing is that, so this is it's not still in the web, but it will be at the end of this, the beginning of next week. The other point is to have a kind of library in which you can hang articles, guidelines for the global population, multimedia, any video related to TB. Also, for instance, posters, theses, guidelines that in any kind of language. So it pretends to be kind of library on TB. This is in the official documentation, presentations, posters, theses, and also patent information. So again, this can be hung and it can be bought. I mean, can be scored by people as well. So at the end, in both cases, this scoring, both this kind of journal club that will be this library, actually. The winner of the most vote document or the most vote question or answer will be invited to come to the next symposium here in Barcelona next year. So this is kind of a prize to that. The other interesting thing is that we have this geolocalization. This will be set for different items, in this case for the who is who, but also for the number of publications that will be put in the internet. We have informatic department from the Open University that is very active in this regard. So this will be updated, will be real time. So it's important, well, to see how is the activity on the TB field. And another important thing is the pipeline. So we will connect to different enterprises in order to put their products in development in here, provide this space here, and to update that constantly. So it will be a kind of, we would like to be a kind of easy way to look to the different products in the clinical development, treatment, vaccination, vaccines and diagnosis, in order to anybody that is in the field, just to update instantly, or say, well, how was that antibiotic doing? So it's in phase 2, or it's in phase 3, or it's in phase 2B, or it's about to be licensed, or whatever. So this wants to be very dynamic tool in order to be updated instantly on the development of new tools against TB. So well, this is all. Thank you very much for your patience. And well, we think we have a very nice panel here today, which is why we are here to try to discuss on the eradication. We have, I think, very interesting speakers. So we encourage you to be very active today, to try to disturb as much as possible, to challenge as much as possible the speakers. Try to to understand if it's possible to eradicate TB, when, if it's a chimera, or it's something that it's available with some more effort from everybody. Thank you very much.